Hello, this is Dr. Arti Kandolkar. I'm a consultant psychologist and a counselor. Today, we are going to touch another topic in schizophrenia, that is type of schizophrenia spectrum and other psychotic disorders. So, we are going to discuss various forms, okay, in which psychosis may occur, and it has come in under DSM-5, schizophrenia spectrum and other psychotic disorders. There is schizophrenia as well as other psychotic disorders which are there. We'll be covering those. Okay. So what are the types or forms it may come into? So that is schizotypal personality disorder, delusional disorder, brief psychotic disorder, schizophreniform disorder, schizophrenia, schizoaffective disorder, and catatonia. Okay. So we'll be discussing one at a time. The first one is schizotypal personality disorder. Now, when you read this, okay, you may say there is personality disorder in this. Okay. So yes, this topic appears in both schizophrenia spectrum and other psychotic disorder, as well as the same topic will be appearing in our personality disorders. Okay. So why this is under psychotic, like other psychotic symptoms, is because with schizotypal personality disorder, if it is just a personality disorder, there may or may not be psychotic symptoms, okay, person is experiencing. But when it comes to under schizophrenia, they are likely to have psychotic symptoms. And if they have psychotic symptom prominent, okay, whether hallucination, delusions, mood, or cognitive symptoms, okay, it is like you put this schizotypal personality disorder into schizophrenia spectrum and other psychotic disorder. Okay, let's understand this. Schizotypal personality disorder. So understand this: a pervasive pattern of social and interpersonal deficit. Okay, it's a pattern of social and interpersonal deficit. Okay, with reduced capacity for close relationship. That is like it hampers the person's ability to function normally or in relationship with someone. Okay, so at least 5 of these symptoms should be there in order to identify it as schizotypal personality disorder, whether it is personality or you can say under psychotic. Okay, ideas of reference, we have also covered this in our past videos. So this is like ideas of reference means somebody is talking there out. Okay, they may not even know you, but since you have delusions, okay, you have ideas of reference. This is a type of delusion wherein you feel other people, whoever is talking, they are referring to me, or they are talking about me, or they are taunting at me. Okay, they are giving me sarcastic comments, all those things. Next is odd belief and magical thinking. Now, what is this magical thinking? They may think like, since they are like not in their proper thought, if I sleep on my left side, it is going to rain tomorrow. Okay, or something like that. It's very magical. Okay, they may even go for ghost hunting and those kind of an activity because their thoughts and beliefs are very odd. They are not thinking normally. Second, unusual perceptual experiences, including bodily illusions. They may sense something which is not normal. Okay, odd thinking and speech. Their thinking may be very odd, like not very normal, means like, or even the speech, they may talk as if it is rhyming, okay, or as if it is they are singing while talking. Okay, so this is like very odd thinking and speech. Suspiciousness or paranoid ideation means they doubt people, even their family members for that matter, or doctors. So these people, like with this point, may have difficulty even trusting their own doctor if they go for the treatment. Okay, then inappropriate or constricted affect means their emotional expression is not proper. The next is behavior or appearance that is odd or eccentric. Suppose it's a very hot day, they may be wearing 3-4 sweaters, or they may wear 3-4 jackets on top of the thing, then they'll put hat, they may wear a blazer and suit with the slippers, so it looks very odd. Okay, as you say, so that because their thinking is odd, they are doing that, so your behavior is also getting odd. Okay. Lack of close friends and other than first degree relatives, since they may be staying aloof. Okay. And they are, since they are not matching with the like what you can say frequency of other people, they may not have so many people to what you can say express their things or share. Okay, so they generally have their first degree relatives or their parents as their close people. Then excessive social anxiety that do not diminish with familiarity, means even you know that person for maybe longer period of time, you know that person for a month or year, even when interacting the next time, you may be feeling unfamiliar, like how should I start? You get so uncomfortable because there is a lot of excessive social anxiety present in schizotypal personality disorder. Okay. Now, if you know what types of anxiety will be appearing in our other videos, so please check those. Okay. Causes of schizotypal. Okay, the symptoms of schizotypal personality disorder so often resembles those of schizophrenia, as we already talked. This is appearing in both. Okay, this disorder. They are like, the symptoms are linked to family conflicts. Okay, abuse and neglect. So one cause is like they may have never got proper attachment style, means parenting style of attachments, or they may be a lot of conflict in the family. The children have not grown up happily, satisfactory. The next is there may be a lot of abuse, physical, sexual, emotional abuse that has happened in the family or because of some family members. Okay, and neglecting childhood. Okay, or they may unwanted as a child. So all this impacts. Okay, this is one of the cause that has been identified. Next is genetic. Okay, one more reason is genetic. Psychological disorders in parents or family. So it's generally like, what is the cause of this schizotypal personality or psychotic? As a psychotic, it's that could be genetic reason, that in your family there is somebody, maybe both parents are having psychotic symptoms, schizophrenia, or suffering from schizophrenia or other similar psychotic disorders. Okay, so they tend to have this. So genetic factor is one of the reason. Predicted high dopamine activity. So if there is release of too much dopamine level, okay, this is according to the research. Okay, high dopamine level could be the reason for schizotypal. Then the disorder has also been linked to the mood disorder, especially depression. Okay, so it is related to depression as well. So these are the causes. Treatment of schizotypal. So we have seen the causes. Now, what can treat or what can help the people who is suffering from schizotypal? Therapy is a difficult in cases of schizotypal. Why, you know? Because they have difficulty in trusting people, confiding in others. Okay. So first of all, they will refuse going to a doctor. Okay. So therapy is very difficult, although not impossible. Okay. As cases of paranoid schizophrenia disorder. Next is psychoeducation. Now what next is that when the family members of people who are suffering from schizotypal come to a doctor, if he's not taking medicines or he's not taking therapy, then what they can do is psychoeducation. So doctor's role or therapist's role would be to educate the people in which, okay, all the people with client is interacting with, maybe their workplace, at home, neighborhood, wherever. Okay, so the most therapists agree on the need to help the client reconnect and recognize the limit of their thinking and powers. So it is like cognitive restructuring kind of a thing. They may be a person can go for even the daycare center or a hospital, and what they are thinking is to getting back the person who has lost their major functions or major functionality, get them back or reconnect with the reality, or make them understand the limit of their thinking and what you can say the powers of their thinking or abilities. Okay. The next is CBT, cognitive behavioral therapy. As I said, it's difficult to work therapies on these people, but if it works after the medicines, okay, further try to teach client to objectively evaluate their thoughts. So as we know already, CBT is something, if your thoughts are abnormal, illogical, the CBT therapist try to modify, or you can say try to replace the negative thoughts into positive ones, okay, which helps you, and provide speech lessons and social skill training to the person. So there are various homework, various techniques are used in CBT. Okay, we'll be discussing this in detail in the next series of lectures. Then antipsychotic drugs is a medicines. Okay, so this is like appear to somewhat helpful in reducing certain thought problem. It will not directly treat the schizotypal personality disorder, okay, but it will definitely, if it is comorbid with depression, anxiety and things, so certain kind of medicines are going to help definitely. Okay, the next is delusional disorder. Okay, this is the second one. So we'll understand what does this delusional disorder mean. Okay, so delusional disorder, just go ahead. So this is like delusions means, as we know, there is a thought process that, and that thought process is impaired. Okay, your thoughts could be very subjective and very weird, like somebody is inserting their thoughts in my brain, or trying to withdraw my thoughts, or monitoring my thoughts and behavior, or controlling my behavior. Anything you can have delusions of. Okay, like there could be also, yeah, like you are spied on, somebody is constantly keeping an eye on you, you are being drugged, okay, you have been followed, slandered, cheated, or somehow mistreated. So this could be various thoughts you can have. Okay, they can be mixed or unspecified. Then delusional disorder is a mental illness in which patient presents with delusions but no accompanying prominent hallucination. You have to remember, when it is delusional disorder, it doesn't, I mean, it should exclude of hallucination. Okay, then like delusion means it is mostly concerning about the various kind of delusions, as we discussed in the other video. Okay, there should be no accompanying prominent hallucination, thought disorder, mood disorder, or significant flattening of effect. Okay, they should not even have thought, any kind of thought disorder or mood disorder. So you have to thoroughly evaluate what exactly is happening, whether it is really delusional disorder or schizophrenia type or what. Okay, delusions are a specific symptoms of psychosis, as we know. Okay, hallucination and delusions are the two major psychotic symptoms. Most of the delusional disorder are probably unrelated to schizophrenia. Okay, it's like they can be not related to schizophrenia, although they may appear, they may be difficult to distinguish clinically, particularly in their early stages. But it's not that easy to looking at the person or interacting with him for a few times and you say whether it is really delusional disorder or whether it is some other psychotic disorder or whether it is schizophrenia. It's difficult, but you have to take at slow pace. Okay, take your own time, take a detailed case history and everything. That is more or less about delusional disorder. Let's see the diagnostic criteria. Now, as we know, delusional disorder, there is some diagnostic criteria. You cannot say just because there are various kind of delusion, that person has actually delusion or some other psychotic disorder. Okay, let's see what are the main key features. Essential features are existence of one or more delusions. Okay, so one or more should be there, that occur for at least 1 month or longer. So at least 1 month is the criteria of these symptoms, and one or more delusions. What are the various kind of delusions? There can be delusions of control, delusions of persecutory, delusions of ideas of reference, delusions of somatic, or they could be religious. Various are there. Okay, so let's see what are these. Existence of one or more delusions that at least occur for 1 month okay, and no other psychotic symptom. No other psychotic means there is no hallucination. Okay, there shouldn't be hallucination. Even if there is hallucination is there, it should be brief, quickly coming and going. Okay, if it stays for longer, more than a month or something, then it will go into some other category. Okay, so criteria A, or you can say criteria for schizophrenia is not and never has been met. So the criteria for schizophrenia should not be met in order to identify for delusional disorder. The next, apart from delusions, direct effect functioning is not obviously impaired and behavior is not noticeably strange. Okay, so apart from your delusions, your thought impairment in your thought process, functioning is not obviously impaired. Means in this disorder, a person can do his routines very well. He can go to job, take care of his family, do everything. Okay, and behavior is not noticeably strange. It's like just like any other normal person. But only problem is that they have delusion. Like they may have thought like somebody is trying to control my brain, somebody has inserted some chip in my brain, or somebody is trying to harass me, they want to throw me out or something. Like they may have some negative thoughts which are very difficult to change. Okay, this, so that is why very difficult to even identify in the clinical practice, okay, whether it is normal or whether it is not normal. The next, any manic or major depressive episode have been brief. As I said, even if it is major depression, okay, whether it is manic symptom or depressive symptom, it should be brief. Okay, if it is longer, then there are various other categories to put this into. Should be brief compared to the length of the delusional period. What is the length? It's 1 month, at least 1 month or longer. Okay, the disturbance cannot be attributed to physiological effect of substance. One more thing you have to be very careful of. Now, psychotic symptom occurs also because of extreme intoxications. Like if you take a lot of alcohol, if you like, it is like alcohol induced psychosis is there. Okay, in this you can also experience delusions. So it should not be because of you have taken some drugs, you have taken some alcohol or some intoxication. Okay, it should not be that. Another medical condition, it's because you are taking some medicines which have potential of creating delusions. I mean to say psychotic symptom in you. So should be aware that there is no medical conditions and you are not taking some medicines which can have potential to create those symptoms. And another mental disorder like mood disorders or maybe any other disorder. Okay, so this is, you have to be careful of. Prominent delusions, just to look at this, is delusion of persecution. You being persecuted against. Okay, somebody is plotting against you. Delusion of grandeur, inflated self-esteem and self-image. You feel so you are something grand, you are some great personality, or you yourself are God. Delusions of jealousy, infidelity. It's like you are jealous of your partner, okay, or you feel that partner is having some extramarital affair. In fact, you may be doing the same and you are like jealous of that, okay, and or you are like trying to put those things like on other partner. Okay, so, and you judge that person of being not so, what you can say, faithful to you. The next is somatic symptom. This is like bodily symptoms you get, that you are sick or you got cancer, you get some, or something is crawling in your body, those kind of a thing. Mixed or unspecified, you may get all this kind of symptom like delusions of grandiosity, jealousy and things together, or very specific or mixed type. Okay, it is important to note absence of prominent hallucination. Okay, so you have to be very careful that there is no hallucination. Okay, no hallucination should be there. Organic mental disorder, which can also produce delusions. Okay, schizophrenia and other mood disorder, in order to separate this from delusional disorder. Okay, so treatment of delusional disorder is, it's very challenging to treat this, as we already discussed. Okay, So it is antipsychotic drug is something can be used initially to control agitation and treat psychotic features. Okay. So again, the delusional person, as they are paranoid in features, okay, they may not go to doctor and they don't even believe that they have some issues. Okay. So it is like, if you can give them medicines somehow, it can be really helpful. Okay. And if they get ready, so this, though other antipsychotics or without antidepressant have been used effectively. So it is generally used with antidepressants. Okay. Supportive psychotherapy can be useful. Antidepressant and electroconvulsive therapy, okay, can be needed sometime when it is too much out of control. Cognitive behavioral therapy may be useful if the client is coming for therapy. And medications for antipsychotic. Since delusion itself is a psychotic symptom, antipsychotic is necessary to control the agitation. Now, one more thing to remember here while diagnosing delusional disorder is there could be something like postpartum depression. Postpartum depression. Who suffers from this? Mainly the women who give birth. Okay, soon after the birth, they undergoing various kind of hormonal changes. In this, they temporarily may get delusions. Okay, they may themselves or their family member, they may consider that they are something demons or something very harmful. Even their kids, they may try to kill their own kids under this influence. Okay, so this is like, it could be a temporary symptom of postpartum depression and not delusional disorder itself. Okay, it's not a psychotic disorder, but temporary they are getting. So be careful about this. Please state whether the postpartum onset is there. You have to identify this. If onset is during pregnancy or within 4 weeks of 4 weeks of postpartum after the birth. It may begin from day 1 and it can last for few weeks to 1 year. So see, the duration could be just 1 day. It could be few weeks or it could be year. It won't go mostly after a year, but it is like, this could be just postpartum symptoms and not delusional disorder. This is one more criteria to look into while diagnosing. Okay. Suicidal risk is similar to that of schizophrenia. Now, this 295 is clinical term to identify for in the DSM-5. Okay, so this is like code. Only the psychiatrist and clinical people will know. So this is suicidal risk is that of schizophrenia, means delusional people who suffers from delusions have similar risk of doing suicide as in schizophrenia. So this we need to again be careful of.